Welcome to the Women's Connection. I'm Barrie-Louise Switzen, your moderator. The Women's Connection is a program about events shaping women's lives and helping one gain authentic power on a personal or professional level. So won't you stay tuned?
Welcome. Our health is our most important asset, and without it, we can't accomplish our goals. Whether we travel here in the United States, or stay home, or travel abroad, there are things that we need to know. And with me is Dr. Saralyn Mark, and we're going to talk about past, present, and future medicine. And I would like to welcome Dr. Sarah Mark.
Thank you so much. I'm delighted to be here with you tonight, Barrie.
Thank you. Same here. Tell us a little bit about your background before I start asking all my questions.
Well, I'm trained as a physician. I did fellowships in endocrinology, which is the study of hormones, did another fellowship in geriatrics, which is the study of older individuals, and also designed and completed the country's first women's health fellowship, which was a multidisciplinary fellowship. So I had an opportunity to work with doctors and researchers from all different areas, from cardiology to geriatrics to radiology. And today there are over 19 fellowships in the U.S.
That's incredible. Let's go a little forward here. You're involved with NASA.
Yes.
How does what happens at NASA affect our health back here on Earth?
It's been a great honor to work to advise and consult with NASA over the last 14 years. When I was a little girl, I wanted to do two things. I wanted to be a physician, and I wanted to practice on the moon. So coming to NASA was really a dream come true, and I've been a medical advisor there, as I mentioned, for several years. The space program is very exciting for us because the body adapts when it goes into space. In a sense, it looks like accelerated aging. There are many changes in every system of the body, and what's really exciting is that we have countermeasures to slow down some of those changes in space, and we also have extensive rehabilitation for our astronauts when we come back. So in a way, we're almost reversing aging, and I think that is extremely exciting because we're a population of older individuals. We're growing older every day.
As we age or get finer, what do you see coming down the pike as we age that can be related to NASA's techniques that have advanced our health?
I recently published a book entitled Stellar Medicine, A Journey Through the Universe of Women's Health, and that book was a part memoir, part guidebook on controversial health issues. And I look at the political and social environment which shapes decisions, weaving in a lot of my adventures around all the continents and certainly with the space program. What's interesting about space is that the body adapts very quickly and very dramatically, so we're able to discern differences between men and women, and we see that in every area of the body. When you go into space, every system of the body changes, and one of the areas is muscle and bones. What we see is that bones become thinner and muscles become thinner as well. You begin to lose muscle mass and bone mass. What we've been able to do is discern some differences between men and women, and we've also developed countermeasures to try to slow down that loss, as well as developed extensive rehabilitation measures so that we can help our astronauts regain some of the muscle and bone that they've lost. Now, osteoporosis tends to be a disease of women. 80% of those afflicted are women. We tend to see it in older individuals. But what most people don't realize is that men do get osteoporosis as well. And when they do develop it, they're at very high risk for developing hip fractures, and they actually have higher death rates after that first hip fracture.
It's a known fact, but what is the best way to build up your bone mass and try to eliminate osteoporosis?
I mentioned in the book that health really begins from the time you're born to the time you die. We're in a constant state of change and renewal. We build about 90% of our bone mass by the time we're around 20. We build maximum bone mass by the time we're around 30, 35. What most people don't realize is you build half of that by the time you're in your adolescence. So when our mothers and fathers told us to drink milk, there really was a reason behind that. When you build your bones, this is the bones you're going to have for the rest of your life. And as you get older, you begin to lose bone mass. So by the time you get into your menopausal years, you may begin to lose 1 to 5% of your bone mass per year for the first 3 to 5 years. So that's a lot of bone mass. What we see with the astronaut core is that you may lose anywhere from 1 to 5% per month, not years. So the space program is very, very concerned about this issue.
And have they come up with a resolution to, build it up, since you're saying that by the time you get into the space program or you're a geriatric, you're basically on the downside for maintaining bone density?
It's a really good question. The International Space Station, which goes around the planet every 90 minutes, it's a magnificent vehicle, has been studying this. And what we are learning is that if you exercise, you can slow down loss. We're also looking at the treatment of medical treatment using drugs to see if we can slow it down that way, and certainly nutrition plays a role. These are all modalities that we use here on Earth. In space, it's a bit more challenging, but it's going to be very important for us to understand how to slow down bone loss, and certainly how to prevent it, and certainly how to get it back if we're really going to do long duration space travel, to go to those asteroids or to go to Mars.
Well, I know, even though I've gone to space camp, I'm not about to go to Mars or even to the moon. So I'm here on Earth, and I take vitamin C's, I take a lot of calcium. I don't know what else to do to maintain my bone density, because at one time I had a very high density, and I'm sure after menopause, which I had to admit I've been through, it's gone down. What can I do? I mean, is walking good for building bones?
Walking is fantastic for almost everything you can do for your body. It's great for maintaining muscle strength and coordination. It's great for maintaining bone strength. It's great for your mental health. It's great for your cardiovascular fitness. Just walking. You don't have to go to a gym. I tend to tell a story in my book about how shopping can be a great form of exercise. And let me give you a couple reasons why. Got a great sale, you may walk a little bit faster, so you get some aerobic conditioning, which is great for your heart. You get there, you buy a lot of good things, so you have some weight bearing activity because you're carrying all your bags. And women especially tend to shop in groups. We tend to shop with our family members, our girlfriends, and we know that when women come together, the stress hormones in our bodies tend to go down, blood pressure levels can go down, and the feel-good hormone, the hormone we call the love hormone, or oxytocin, may also go up when women are together. So for example, just by doing this interview, we're doing great stuff for our health because we're bonding as women and our bodies are sensing that.
That's incredible. So it goes back to the old theory that you have to have a lot of friends in your old age to keep your stress level down, your what was that again? Oxytocin
Yes.
Down, or elevate the good things and eliminate the bad things.
Yes.
And what I'm just a little concerned about is that a lot of our foods are genetically, GMOs? I just feel that the pharmaceutical companies, between our foods and what they're doing to it, and telling us we shouldn't be taking vitamins, but we should take all this medication that they say is the latest and greatest, and then it comes out that it's not the latest and greatest. Where do you draw the line, and what do you do to maintain your health?
We live in a really phenomenal age. We're in an age where we can do good prevention, good diagnosis, and hopefully good treatment when disease is detected. I think with the Affordable Care Act, our health insurance bill, we're putting a lot of effort right now on prevention. So talking with your physician or your nurse about some basic behaviors that you can adopt, such as you mentioned, walking, getting sleep, trying to de-stress through connecting with people, and certainly exercise are all very helpful. When you have a disease, we are fortunate that there are medications that you can treat. For example, for diabetes. Often I would advise my patients when I'm beginning to see high blood sugar levels that they need to watch their weight, they potentially need to lose weight, they need to increase their exercise. And for some of my patients, that can improve their sugar levels by about 10 to 20%, their blood glucose levels. But sometimes patients do need medication, and we are fortunate in this day and age that we have medications that have been tailored to treat disease. Now, we're entering a very interesting time, and that is to understand how men and women deal with medications differently. For example, over the past decade, 8 out of 10 drugs had to be pulled off the market because they were more toxic in women. So I don't know too many people who actually go to their pharmacist or their drugstores and ask, has this medication been tested in a woman? Has it been tested in a man? But I think we're going to start doing that. The Food and Drug Administration just released some new regulations that are basically mandating that pharmaceutical companies need to begin doing these studies. And I think it's really exciting because we need to begin to tailor care better. And what you're talking about, Barry, is what we're dealing with in the world of personalized medicine or predictive medicine, where we begin tailoring therapy directly to what you need. And we look at your genetic code, for example, to help guide us. We're in the very early stages of doing that, but it's a very exciting future. And we've learned a lot, for example, from the breast cancer community, because we really are trying to tailor care to what's going to give you the best benefit and minimize the side effects.
Well, that brings me up to another issue on, as long as we're talking about breast cancer. Mm-hmm. Everybody says, go and get your mammogram. Go and get your mammogram. Go and get your mammogram. And how often they say, at least once a year, there's age guidelines and family history guidelines and everything else. But now there's a new thing that's out on the market that you don't hear a lot about, and that's thermography. So what is the benefits and the side effects of both?
Well, there's all these new modalities to try to image breast tissue, and we have mammography now for about 40 to 50 years, and it's about the best technique we've got. It may miss breast cancer in younger women, especially younger women who have what we call fibrodense breast tissue, and it may overdiagnose something in women as well, so then women need to go for breast biopsies. And that was part of the controversy that we've seen over the last few years about what is the best age to get a mammogram. I think it's important for women to become familiar with their breasts, not to go seek and search and divide their breast tissue, but to really begin to understand what their breasts feel like. So, notice if you have a lump, something feels uncomfortable, begin to track it if it goes along your menstrual cycle. I do think it's important for women over the age of 40 to have an annual mammogram. We do recommend, if you have a family history, especially a first-degree relative, for example, if your mom had breast cancer, you may want to start earlier, and this is where you really need to talk with your physician. We have some technologies that are used to augment conventional mammograms, and one of them is computer-assisted diagnosis, CAD, where the image is digitized. It's put on a computer screen, and your radiologist can increase the visualization to see if there's actually a mass there. We also are looking at three-dimensional modeling, which is really exciting, and it's going to be complementary to conventional mammography. For some women, they qualify to have MRIs, which also give you that beautiful three-dimensional view. If you've had breast implants, it's highly recommended that you use that technique. But it can't be used on a mass scale because these technologies are very, very expensive, and not every facility has MRI. What I love is the thought that someday we're going to actually be able to use biomarkers, so that biomarker is injected and you're able to have a scan of your breast tissue and see if something is picked up where there's breast cancer, so you can go to the appropriate place and biopsy, and then if you need to tailor therapy can be targeted right to that mass.
Now, where is thermography in this whole thing? Because I know some people swear by it. They say it's great. You don't have to get squished like a refrigerator. And also the other part of having a mammogram is the fact that you get all these detrimental rays to your body that keep adding, especially if you go for a dental x-ray or you happen to have a CAT scan. It just keeps compounding your system.
Let's talk about radiation. Radiation is all around us. We get ambient radiation from just walking outside, from flying in an airplane, from walking on a beach. And it's a cumulative impact over a lifetime that we do get concerned about. There are some people who have genetic mutations, for example, the ATM mutation, ataxia-telangiectasia mutation, that they are at very high risk to any type of radiation. And it's a very, very small percentage of the population. Fortunately, a lot of our technologies today are being screened for the amount of radiation, and one of them certainly is mammography. So an annual mammogram is quite low. I think techniques such as thermography and ultrasound and MRI and CAD really will complement for some women who have difficult breasts to image, for example. But it's not going to be one or the other. I don't believe we're at that point just yet.
I know when I go to my doctor's office and I ask him a question, and I have this feeling that when I ask him a question, it's about you're getting old. It's not like it used to be. Things are changing. Well, that's really great. But what can I do to slow down the process of this and that and whatever? Because I feel, not that I'm getting a runaround, which I probably am, is that he doesn't know the answer himself. What do I do?
Well, I think when you go to your doctor and she may talk to you, again, women and men are physicians, that you need to come as a prepared consumer. And that was one of the reasons why I wanted to write Stellar Medicine, to be used as a guidebook. I think we're being bombarded every single day with television shows, radio shows, internet issues that provide conflicting information. So when you come to your physician, you can be a bit confused, and you don't have a lot of time between speaking to him or her, having to get undressed to go through your physical exam, and then having to have a follow-up talk about what your next steps should be. And you all have to do it within 7 minutes. It's just not enough time. So what I would recommend is that you come up with a list of your concerns, write them down. You may also want to bring a family member or friend with you and have them briefed on what your concerns are. And then talk to your doctor before you are examined. And I think it's important, if you can, that you don't have your clothes off and in your gowns, so that there's a level of parity here, so that you can have a frank discussion about some of your issues, and your physician can then begin tailoring the physical exam to what those concerns are. Now, it may be that you have some questions about your medications or about some behavior that you need counseling on. That may be a separate exam time. It may not be during the time you're coming for your physical exam. So make sure you have a follow-up appointment. So it may take more than 1 or 2 visits. Now, we are getting older. That's the beauty of it. We're getting older, but there is something called healthy aging. And fortunately, I think the body is designed to really try to stay in sync, to try to be healthy. When I wrote the book, I wanted to look at basic strategies that you could adapt and adopt in your life so you could live a life of wellness and balance. And some of them we can talk about, but it's having a healthy mind, as well as doing very simple things for yourself so that you can stay in balance. Good nutrition, physical activity, thinking about the vitamins you're getting in your diet. And the other one is the impact, and this is one that sometimes is a bit controversial, but the impact of spirituality and faith in your life. And what do I mean by that? I think we're all connected. I think we're all exquisite stardust. We're all connected. So it's that element that it plays a very important role to keep us healthy and well.
Well, before we go on to spirituality, which I'm really in favor of, one of my favorite chapters in your book, Stellar Medicine, is sex, wine, and chocolate.
Yes.
And there's been a lot of controversy about chocolate. Why don't we start with chocolate, the good, the bad, and the indifferent? Because I'm a chocoholic.
And I call it vitamin C. The chapter is called Sex, Chocolate, Wine, and Shopping. And I wanted to write that chapter because we tend to demonize life's pleasures. And I found that if you do something in moderation, you actually get the benefit. Now, there are some people out there that have addictions to wine, or they have addiction to shopping where they can't just stop. And this is where it's a little bit of a different discussion, where you may not be able to have that glass of wine. But for a population that doesn't have these addictive issues, I think a glass of wine a night for a woman may not be a bad issue. I think in regard to chocolate, chocolate is very interesting. It's got antioxidant properties, so it may help repair some blood vessel issues, which can lead to coronary artery disease. It can release serotonin, which is that natural antidepressant. It has properties that are very healing in the body. Now, with that said, and we tend to recommend dark chocolate because it's been less processed and less filled with sugars, which adds just calories, and sometimes milk products, which may just add fat, is that you have one morsel. You have one piece. I've often had patients come in and say, "Hey doc, I did something great today. I ate 2 candy bars. Well, that's not great because there's high caloric content and high fat content. I often recommend that you get a package of little chocolate bits that you put in your chocolate chip cookies, and you just take a handful of that, and you're very conscious of each little bit that you have in your mouth, and you're not depriving yourself. When we live in a life of deprivation, what happens is we become obsessed with it, so that when we get it, we don't know how to stop. And that's where I think moderation plays an important role.
Well, the other part of the chapter is sex.
Mm-hmm.
All right, and you're talking about moderation. One of the highest figures is for women who've got either HIV or some kind of social disease that they've got from unprotected sex. Mm-hmm. Now, there's a lot of widows, there's a lot of divorcees on both sides, will be widower. Mm-hmm. How do you bring up safe sex, and how many times have you had a partner that could possibly infect you without, using a condom?
Barry, that's a really important question, and it's probably one of the most difficult. When I wrote that chapter, I put a few questions in there about how do you talk to an older individual or perhaps your own mother about having safe sex, sort of role reversal here. The fastest growing population for HIV/AIDS is actually older women. And what happens is that as you age, the vagina becomes a bit thinner, so that if there's any abrasion due to sexual intercourse, you may have greater entree for viruses such as HIV. Often your partners may be older too, and they may not like using condoms because they think it really is a detriment for them to maintain an erection, for example. But it is extremely important to have the discussion with your partner. Ask them if they've been checked for HIV and other sexually transmitted diseases, and to also use a condom until you're sure you're in a monogamous, protected relationship. Now keep in mind that you can be checked for many different diseases, but not all of them. And sometimes your partner may not know that he is a carrier. For example, we have seen with herpes that unless they have a breakout, they may not know that they're carrying it. Or another one can be for condyloma, where they don't know that they have genital warts, and a woman may develop it. So it's an ongoing discussion. I don't want to create fear and confusion, but I think these discussions are important. And I often tell people that if you're willing to share your being, share your body with somebody, then you've got to be willing to have these frank discussions. It's extremely important. Maybe you can interject a little bit of humor into it, but I think it's very, very important because you've got to protect your health.
Now, wine is supposed to be very healthy for you. But I just read recently that if you have more than 2 glasses a day or a week, and you smoke, it all plays havoc with your system. Yeah. What do? I'm not a smoker, and I'm more of a teetotaler than a drinker, even though I do like good wine. But yet, I'm concerned about the pros and the cons. Where do I go? What do I do?
Well, first of all, with smoking, there are no health benefits for smoking. Now, I know a lot of women say they smoke because it helps them keep their weight under control. There are other ways to do it. Smoking has no protective impact on the body. Not only is it associated with heart disease and cancer, such as lung cancer, even cervical cancer, it ages you. Just look at the skin of women who smoke. It's like putting tourniquets on blood vessels, and it helps to age the skin as well. There is just no benefit to smoking. Smoking and drinking can put you at higher risk for developing esophageal cancers as well as liver cancer. So it's a compounded problem. Now let's talk about alcohol. Women metabolize alcohol differently from men. It's metabolized differently in the liver. Just one drink can have greater impact on a woman than 2 drinks in a man. So that's why we say for women, you need to limit it. We tend to talk about that 1 drink rule. Now, we have seen an association for some women with alcohol and breast cancer, and it's sometimes confusing data. Often some people say, make sure you get enough folate and vitamin in your diet, enough B vitamins, maybe you can eat more salads to maintain that. I think the question here is really moderation and balance. With alcohol, it may lower your blood pressure a little bit. It has some antioxidant properties which may help repair damage to blood vessels. But I think it's important, again, moderation, and to be very conscious what you're doing. Now, the other thing to keep in mind is that you tend, especially if you're drinking something that is clear alcohol, you think you're drinking water, but you're not. You're drinking something that has caloric content. So that can also put pounds on you, and we know that increased weight is associated with increased medical problems as well.
With seniors, from what I'm hearing more and more, they've got sleep apnea. What can they do? Well, it's not only seniors, it's a lot of young people too. What can you do to eliminate it or reduce it, or can you eliminate it?
Well, sleep apnea is also known as Pickwickian syndrome, and it got that name from the Charles Dickens character of somebody who was generally very overweight. We have seen with individuals who are overweight, certainly with those who are obese, that they may have problems with breathing, especially at nighttime. And with sleep apnea, you stop breathing, and your body then kicks in, so you're gasping for breath. And we know that it's associated with higher rates of cardiovascular disease, strokes, for example. There are a couple things you can do. One is trying to lose weight. That is often very helpful. Also trying to have your bed elevated, trying to minimize the amount of alcohol in your diet, especially before bedtime. But there are also devices you can wear that provide positive pressure. We call them CPAP. And you wear them over your face, especially over your nose. Some patients don't like it. They feel very claustrophobic. But that can help them to mitigate the sleep apnea that they're experiencing and give them better restful sleep. Now, it tends to have a noise with it, so it may keep the people around you awake. Now, if your partner or you're snoring a lot, you should probably go for a sleep study so that you can be assessed to see what your sleep patterns are like.
In the closing moments of the show, what would you like to leave the audience with?
Well, I want to leave the audience with the message that it's never too late to take charge of your health. Writing Stellar Medicine for me was really a labor of love, and I felt it was important to share information that I've gained from living my life, from hearing the experiences of my patients, and from seeing what has worked and what has not worked. I find that there's simple steps that we can take to live a balanced life, and one of them is to be very conscious of what we're doing. That includes nutrition, how much sleep, how much activity we get in our lives. We really actually even have to put it into our daily binders, our schedules, to be aware that we need to go for that walk. We need to make sure that we take time to meet with our loved ones. It's becoming conscious, and also to realize that it's never too late, no matter what age you're at. If you live to the age of 80, you got a very good shot to living to the age of 100 and perhaps even climbing that mountain. And I want to leave with the message of hope and optimism. We live in very turbulent times, but they've always been turbulent. And I think in this sense, stress allows us to grow, to develop, and we're here to love, we're here to learn, and we're here to grow.
Well, Doctor, thank you so much for joining me. It's been wonderful, and I can't wait to see a woman walking on the moon or Mars, or let me say outer space, wherever. Love to hear from you. Look forward to hearing what your comments are and your thoughts. And Dr. Marks would be delighted to answer any of your questions also. Bye now.